Welcome to another episode of Wild and Well. Today I am joined by Doctor of Acupuncture and Traditional Chinese Medicine, Dr. Brittany Wickert, to talk all about how we can support our health and our hormones throughout pregnancy, postpartum, and motherhood. So, welcome, Dr. Brittany. I'm really excited for this conversation. But before we get into it, can you tell us one thing that you've done today to take care of
Mm,
you or nourish you?
yeah, I love that. Um, I had a great breakfast this morning. My husband made us really nourishing from a TCM standpoint. So we had like a egg scramble with sweet potatoes, which is really good for blood building postpartum, which is a stage that I'm in right now, and just lots of spinach and all the goodness. And right now I'm just drinking some Chinese date and goji berry tea too, which is so lovely for women's health, especially during menstruation or postpartum too. Really good for supporting the blood, supporting the qi, and that restoration that we need during those times.
Oh, amazing. That also sounds really delicious.
Yeah, it was great. Yeah.
Tea is my love language, so or one of them. So I
Yeah.
love tea. I love talking about it. I love looking at it and drinking.
Yeah.
It's just the best.
Oh, I love that.
So how did you get into working as a traditional Chinese medicine doctor? And can you tell us a little bit about what this looks like?
Yeah, that's a great question. Um, so when I was a young girl, I think I started menstruating at about 12 years old. And my first couple of years menstruating were fine, like in regards of no pain, no major symptoms and things like that. And then once I got into high school, and I think I was maybe in grade 10 or 11, I started getting really bad menstrual pain to the point where I would throw up, I would faint most of the time, and it was just super debilitating. So I couldn't travel during those times of the month. I couldn't like go to my soccer games or if I had an exam or a test that day, I had a lot of fear around it because of I knew what that pain would do and how it would affect my life. So I went to my family doctor, who at that time he had been like my parents' family doctor when they were born. Like he was quite an old man and just wasn't really knowledgeable about women's health and menstruation and dysmenorrhea and pain. So, of course, what he knew was to recommend that I go on the pill. And being a young girl, and my parents didn't really know any better either. So I went on that for a few months, maybe like 9 months. And I just remember thinking, this is working. Like, I don't have pain, but I don't quite feel like myself emotionally. I felt like a little bit disconnected. I'm a super optimistic, like visionary dreamer kind of mindset. And I felt like I was missing that sense of creativity and that, yeah, that kind of sense of myself. So I decided to go off of it. I went off of it. And then I suffered for years with that pain. And um, I moved to Calgary from Ontario. I'm from a little town in Ontario. And when I moved here, my husband now, him and I, we had an apartment, we were dating. And I thought, I want to go back to school. I'm not quite sure what I want to do yet, but I know I want to do something with women's health and pregnancy, postpartum. So I'm going to start by doing my prenatal yoga teacher training. That really helped me with mindset and breathing through pain and showed me how powerful the breath is and meditation, which later I used for my home births of my children too, which is really beautiful to see that come full circle. And while I was teaching prenatal yoga, I started working at a clinic in Calgary called Doctor for Moms. It's this really beautiful perinatal wellness clinic, and there's an acupuncturist there, Dr. Melanie. And I booked in with her and I said, Dr. Mel, I've been having, years of this debilitating pain. I tried birth control, I've tried this, I've tried that, nutritionally, and doing yoga and mindset really seems to help me, but nothing else has. And she did acupuncture for me. She felt my pulse, she observed my tongue, gave me a TCM diagnosis at that time. And the following month I had zero menstrual pain after years and years of like intense 10 out of 10 pain. And I thought, what in the world did she do? I need to understand how this works. So seeing her again and again, and we were working in the same clinic at that time, so I could pick her mind and ask her lots of questions and things like that, which was fantastic. Um, and that really led me to, I think, having that personal experience and thinking, whoa, like this has changed my life. Now I can just live in sync with my cycle. I don't have to say no to opportunities or great experiences or be in fear when I know my period is approaching. And the next year, I enrolled in the Canadian Institute of Traditional Chinese Medicine in Calgary to start my journey to becoming a doctor of acupuncture and TCM and being able to give that back to women here now.
Wow, that's incredible. And what an
Yeah.
amazing experience to be suffering with that for so long and to have such
Hmm.
a quick transitional recovery.
Yeah, it was shocking. Honestly, I was like, okay, this does really work. And, what is going on here? Like, this is incredible medicine. And how didn't I try this for years? How come I suffered for years without giving this a go?
Yeah, it's not one of the more conventional approaches to
Hmm.
healthcare. So it's not your story, unfortunately, is common and isn't
Hmm.
surprising. A lot of the time we struggle with things and we try other approaches, but they often miss the mark.
Yeah, that's so true. Yeah.
So, can you give us a basic understanding of what traditional Chinese medicine is for somebody who maybe has heard the term but really doesn't know much about it?
Yeah, absolutely. So, TCM or traditional Chinese medicine, it's this holistic system of medicine that really considers the mind, the body, the soul. So, we're never just addressing the symptoms that you're coming in with or that are a chief complaint. We're going to take those into consideration and then we're going to really dive deeper into all areas of your health, um, to understand what that root cause is and where those branches or those symptoms are coming from. TCM is over 2,000 years old, which is really amazing to see that it has outstood that test of time and that it continues to work and that we simplify things. So everything comes back down to two main concepts in TCM, whether you're coming in with a headache, infertility, period pain, postpartum depletion, etc. Everything we can break it down into two concepts of yin and yang, deficiency or excess. So we want to break it back down through those layers to figure out where you're deficient, what's working harder than it needs to, and where that dis-ease or that disharmony or imbalance is coming from. In Chinese medicine, too, there's 5 limbs that we use as practitioners to support your wellness. So we have acupuncture, which I'm sure most of our listeners have heard of. We have herbal medicine, which is a favorite of yours and mine, too. Nutrition. We have lifestyle advice, cupping. We use like a fire cupping. So people may have seen images on Instagram. It's really popular right now to post celebrities posting like pictures of their cupping marks on their back after they've got a treatment or swimmers, things like that. And Tuina, which is a type of TCM massage therapy that's combined with acupressure. So really great for children too, especially under 2 years old. We don't typically needle infants and until you're older than 2. So then we can use acupressure and Tuina for little ones.
Oh, that's fascinating. I've never heard of that one.
Yeah, yeah, yeah. It's really gentle and yeah, it's just like a massage therapy, but infused with acupressure.
And what sort of things do you use it for young children?
Yeah, so for kiddos, it's great for like breaking a fever or managing a fever. If they're not feeling good, we use points along the back, between like the thoracic and the cervical spine. That upper back area is really great. There's some points there that are good for managing a fever. We use it for digestive issues if, bowel movements are irregular between loose stool or constipation or upset tummies after eating particular foods, we can help with that. Teething, all the things, basically, TCM and acupuncture, trina, etc. You can use it for anything that you wouldn't go to the emergency room for, is what one of my professors told me in school, and that always stuck with me. And I was like, okay, we can treat a lot with this medicine. It's so powerful.
Yeah, that is a lot of things. And that's the majority of the challenges that parents deal with, right? Whether it's for
Yeah,
themselves or for their kids. A lot of the time, we don't have to go to emergency.
yeah, yeah.
And do you teach the people that you work with strategies to use these in their own
Mm.
lives and with their kids as well, so they have a bit of a toolkit?
I do, yeah. I am super, super passionate about education, and I feel like everything that I learn, I have this deep desire to just like give it away to everyone. I just love Chinese medicine and acupuncture so much. It has changed my life. And I just want every mom to have this information. So um, I do lots of education in the treatment rooms, but I do regularly put on classes and workshops and both in person and online. I have an online course called the menstrual course, and I have one that I also run regularly, the gentle birthing workshop too. We do acupressure for labor prep, and we teach the dads that one too. And yeah, for moms and kids, always we spend lots of time just reviewing and working through those, and so that they can leave feeling confident with those techniques as well.
Yeah, incredible.
Hmm.
So, when we think about women's hormones, why is it important that we understand our cycle? What does
Hmm.
that do for us, and what do we need to know about it?
Yeah, that's a great question. I think that when we break it down, to simplify things, is just that when we understand our hormones and the phases of our cycle that we're in at that time, we're able to live in this really cyclical way that women are meant to. So when we're menstruating, we naturally have lower energy, we're less sociable, we have this desire to slow down, and we want to say no to a lot of things and just kind of curl up, be really warm, and whatnot. So if we can understand when we're menstruating, that's an easy one because we're bleeding, we know that. Then we can follow that to understand the rest of our cycle. So when we move into our follicular phase, that follicle is developing, our energy is starting to increase. This is called our inner spring in TCM. So we're starting to feel, those buds starting to burst, that energy picking up. We start to feel more sociable. We want to connect with other people. We want to share. This is a fantastic time to start a new project, or, if you have like a DIY you want to do in your house, for example, something like that, this is the time for planning. We're visionary, we're becoming more creative. Then we move into ovulation, our inner summer. That energy, that life force is really strong here. Our libido is higher naturally for procreation. So let's harness this natural energy. This is a time to go like full throttle with a project at work or around the house. If you're wanting to do some spring cleaning or clean up the kids' closets and things like that, use that energy during this time. And then we're going to start to wind down during that luteal phase or our inner autumn. This is the time to wrap up those projects. If you want to start saying no to certain things, reschedule them for follicular ovulation phase. And then we move back into our inner winter of menstruation, where we're winding back down and whatnot. So we can kind of start here by understanding which season we're naturally in, and then we can dive deeper, uncovering those layers of what hormones are working more during those times where, you know, um, for example, we really want to focus on progesterone in the luteal phase. So if somebody is trying to get pregnant, we want to keep that endometrial lining nice and thick and strong. There's certain herbs that we could use for that, like chaste tree berry, or it's also called Vitex if somebody was low in progesterone, where during the bleed, we're going to dip in both estrogen and progesterone. things like that. But just starting with understanding your inner seasons, harnessing that energy in a natural way, and then yeah, you can dive deeper from there.
So with those two herbs that you recommended there for progesterone, you take that going in, like in that phase going into having your period, but not during it. Is that correct?
It depends on the person. So we would want to look at sort of their lab values and then the symptoms that they're presenting with as well. And then we would peel through those layers to see what that root cause is from a TCM perspective too. So with some people, if they're showing like low progesterone symptoms, maybe like night sweating and things like that, and the luteal phase, but they haven't had recurrent miscarriage or they haven't had difficulty conceiving, we could just supplement during that luteal phase. But if we have seen some stronger symptoms or we want to make more of a difference, then I would have them supplement with that their whole cycle and for a few months too, until we start to see those shifts and that desired outcome.
And what are some other signs that our hormones, whether it's progesterone or estrogen or other ones, are out of balance?
Yeah, that's a good question too. So, if we're seeing an excess of estrogen, we can see heavier periods. So, in terms of volume, that you're soaking through multiple pads, you're feeling fatigued and lethargic, and that brain fog because we're losing a lot of that blood. So, in TCM, we're looking at that as a blood deficiency, so not just like a loss of iron or deficient in B12 or ferritin and things like that, but also on an energetic level too. So our blood in TCM, it is all of those things, but it's also nourishing the brain, it's nourishing the bones, it's giving us this vital energy and this feminine energy too. The blood in TCM, especially the menstrual blood in TCM, it's looked at as the equivalent of sperm in men. So it's like a holy blood that holds this um, kind of ancient wisdom and sacredness that's passed down through women. So yeah, seeing those symptoms of fatigue and lethargy, brain fog, things like that, and a lack of vitality for the blood deficiency. We can also see a yin deficiency, which could be estrogen deficiency or progesterone. Estrogen is like the yin hormone, and progesterone is like the smaller yin or the little yin hormone. So when we see like night sweating, brain fog, insomnia, things like that, could be a combination of that blood deficiency in estrogen or progesterone. We could dive deeper, look at the labs to confirm that too. And then looking at androgens too and testosterone for um, someone that potentially has a condition like PCOS and things like that too. When we're looking at PCOS too, we're really looking at the spleen in Chinese medicine. Oftentimes, our PCOS women have a little bit of more difficulty losing weight in the abdominal region or throughout the body. We can also see cystic acne too in those patients, or mucosal cysts like in the nasals, or difficulty with lymphatic drainage too, or swollen lymph nodes in the armpits, the breasts, the throat, things like that. So the spleen, one of the spleen's jobs is to produce blood. And one of the spleen's other jobs in TCM is to help with a process called TNT, or transformation and transportation. And it's helping to decrease phlegm and accumulation of body fluid. So we think about the lymph system a lot, clearing out and detoxing naturally. And when it's kind of bogged down or in a place of disharmony, we can see that accumulation of fluids, accumulation of dampness or phlegm, it's called in TCM. So yeah, looking at the spleen, we're always doing, looking at yin energy, looking at blood, and then the liver, of course, too. Our liver in TCM is a primary detox organ. And I mean that in a sense of just naturally supporting those detox pathways of your body. It's also supporting that movement of qi and blood throughout the body to decrease pain and just optimize blood flow. So when we think about my story of having dysmenorrhea or painful periods, I had some major liver chi and liver blood stasis or stagnation happening. Things were not moving smoothly. It was choppy, it was painful. Dark menstrual blood with clots and things like that. So when we're seeing a healthy menstrual blood, we're seeing a healthy liver flow, we're seeing a healthy spleen and production of blood, yin yang balance, optimizing that qi and blood and that vital energy to create that whole body harmony within. Hopefully that answers those questions.
And what do we do if our liver is strained? It seems like in our
Hmm.
modern way of living and everything's busy and we convenience food and people are
Hmm.
stressed, our livers are stressed too. I
Yeah.
assume most people could use liver support. Like, what do we
Yeah.
do to help our liver to function better?
Yeah, that's a great question. So I think our liver loves movement is a great one to remind ourselves of. So the liver's job is to move that stagnant energy, that chi, that blood, and so on. So what can we do to get that moving? We can exercise, we can walk, we can spend time in nature to get our bodies physically moving, attending a workout class, all of those things are so good. Drinking herbs that are opening the channel, so thinking about like dilation. So, um, chen pea or aged tangerine peel with rose is one of my favorite combinations. It's really feminine, it's citrusy, it's uplifting in the mood.
Is that what I'm drinking right now that you
That's what
sent
you're
me?
drinking.
Okay.
Yeah, that's what you're drinking right now. So that one is a great one to start with, opening the channels. And then we want to get things moving. We want to add something more invigorating. So next week in the spring cleanse, you're going to drink Bai Shao and Gui Shi. So those are cinnamon twig and white peony root. So those are going to get things moving a little bit more. Things like dry brushing too are fantastic. Easy to do at home. It just takes a couple of minutes before you get into the shower. Great after doing a workout to continue getting that qi and blood flow moving and also that lymphatic fluid. And then gua sha too. We use gua sha in the clinic all the time. So for our listeners, it's using that like little rose quartz or jade stone that you see on those facial tutorials on Instagram. We use that on the whole body. And it's really lovely for getting that liver chi, that blood flow moving, that lymphatic drainage, and helping to release any emotional stagnation too. I think that that's something I love about TCM is that we're always considering the emotions, and each organ houses a different emotion in TCM. So the liver houses stress and anger and irritability. So when we're feeling snappy at our kids or our spouse or just more irritable or we have this anger and we're not quite sure why, one of the things we want to look at is the liver whenever we feel that way. We want to bring some attention. The liver's trying to tell us that she needs a little bit of love with those symptoms.
A lot of the time, there's a lot of anger and resentment and even mom rage for mothers. Is
Hmm.
that obviously there are other reasons for it, but is liver stagnation, it's associated with those things too?
Yeah, absolutely. So yeah, physiologically we can see the symptoms if we've seen like a dark period blood with clots, but emotionally too, if we see mum rage and yeah, that pent up anger and emotion or that quick temper, quick to react, we are always looking back at the liver.
Yeah, fascinating.
Hmm.
And are there any other strategies from a TCM perspective that you recommend that women can do to support their hormones to be just working as optimally as possible? That they can,
Hmm.
I mean, I'm sure there's lots of different things that you do, but anything that you
Yeah.
recommend that people can start implementing in their life today?
Yeah, I think if there's one thing that I would love everyone to do is to get acupuncture. I think that, it's just it's just this incredible medicine. It's the primary medicine that we use in traditional Chinese medicine that most people know about, when you're going to book an appointment. And it's so gentle. I feel like they almost shouldn't be called acupuncture needles because they're so fine. The needles are they're about as fine as your hair. And sometimes you'll feel a little poke with some of them going in maybe on the hands or the feet, things like that. But most of the time you don't feel them at all. And it feels really warm or relaxing in that area. And it's almost like it all of a sudden just invites that rest and digest state of our nervous system to activate and brings us this really beautiful, deep, meditative calm that we call an acu nap. So you get to rest with your acupuncture treatment and you just really sink into this deep place of reconnecting within that I think we need as mothers when we're so overstimulated and everyone needs us all the time and we're the heart and we're the glue and we're the life force of our homes, which is such a beautiful honor. But acupuncture, when I see my moms just melting on the table during their treatments, I'm like, wow, every woman, every mother needs this in their life.
Yeah, that sounds amazing. It's something that I've only done twice in my life. And
Okay.
actually, recently, there's somebody locally that does it. And I keep
Oh,
thinking I should
yay.
book in, but you're motivating me.
Yeah.
I'm going to do it. I'm going to make an appointment.
Good. Yeah, let me know how it goes.
Yeah. So acupuncture is quite good then for stress reduction and if somebody is struggling with anxiety, I assume.
Yeah. So when we're looking at stress, we're looking at the liver. We can follow the liver pathway or the liver meridian or the liver channel, we call it. So there's particular acupuncture points along the body that follow each organ path. So we have a pathway for the liver, for the heart, for the spleen, for the lungs, for the kidneys, and so on. And along those channels or those pathways, there's specific points that we study. I think there's, in our board exams, we get tested on just about 400 acupuncture points that you don't know which ones you're going to get, but you have to be able to recall them and locate them down to like the millimeter or you fail everything. So it's a lot of time, it's a lot of energy spending on acupuncture studying and for good reason because it works so well. With anxiety, we're really looking at the spleen. So the spleen houses anxiety, overwhelm, that feeling of um, you're just burnt out and it's feeling like a lot. We're going to bring our energy back to the spleen, take a look at that and what's happening. So we're going to follow that spleen pathway then. There's certain points that are indicated for anxiety, that are indicated for craving sweet is a symptom that we experience when we're feeling more anxious and our spleen is in a place of deficiency. Mhm.
And what are some things we can do to support our spleen?
Yeah, so with our spleen loves sweet things. So when we're feeling that anxiety or burnt out, we're going to naturally crave the chocolates and the candies and, the sweet, sugary iced coffees and things like that, which give us that dopamine rush, a quick release, a quick burn, but they're not supporting our hormone balance long term. We're going to have a high and then we're going to have a low crash after that. So supporting your body with nutrition is fantastic and an easy way to do it at home. Things like root vegetables like yams are fantastic because we're getting that sweet, delicious flavor. So, like in my breakfast this morning, my husband added those into our scramble because they're really good for nourishing the spleen and the blood, which he probably didn't notice when he was making it, but it's going to give me that high and satisfy that craving postpartum that we get. And then give me that more sustained energy because it's a complex carb throughout the day rather than just that quick high and then that crash afterwards.
That makes a lot of sense. And that sounds like a
Hmm.
really good breakfast
Yeah.
that we could all try.
Yeah.
So did you puree it or did he and then he mixed it in or just
He
chunks?
he just chopped it up. Yeah, he just did like diced sweet potatoes. We did eggs, I think spinach, and then we had some leftover pork from a pork roast that we had slow cooked. So we added that in too. And yeah, it was good.
Yeah, that sounds great. So if we think about fertility and we just change the lens a little bit, or the focus,
Mhm.
not the lens so much, what do you do to help women prepare their bodies for conception?
Yeah, I love this. So I think one of the most important things that I do, and one of the first things that we do is we really want to optimize blood flow to the womb, to the uterus, to the fallopian tubes, to the ovaries. So women, one of the common things that I hear about women who are trying to conceive is that they feel coldness in their lower abdominal area. And so we really want to optimize blood flow. We want to optimize warmth so that we can create this really beautiful home for this sweet little embryo to grow and flourish. So by using acupuncture points, there's specific acupuncture points along the lower abdomen that we use for fertility and regulating the menstrual cycle. We can also use a little machine that's called an e-stim. So it almost looks like these like little alligator clips that clip on to the acupuncture needles. They're so tiny, and it just sends this little electrical current down the acupuncture needles into the lower abdomen to create more of a response from our nervous system. So it's helping with those peripheral nerves that branch out from our spinal cord into all of the tissues and the abdominal muscles. And, it just tells our body that we need to bring blood flow here. We need to send signals here. Something is going on. Let's bring that harmony back. And then also from that energetic or that chi and blood flow sense too, it's helping to regulate those pathways that we talked about, those meridians or those channels of each organ. So following the uterus points, we call them zigong. They connect down to our kidneys. Our kidneys in Chinese medicine, they house a type of energy that's called Jing or essence. And it's basically like your bank of fertility that you are born with, and your parents passed it down to you from your hereditary genes. Um, and then your uterus also has a pathway up to your heart. So we have the Bao Mai, the Bao Lo, and we want to connect and regulate through the emotional sense of the heart too, down to the womb, down to the kidneys, and so on. Yeah.
So the heart and the kidneys are really critical for fertility and
Mm-hmm.
conception from a Chinese
Yeah.
medicine perspective. I've never heard that. That's really
Yeah.
interesting.
Yeah. Okay. I'll write a post on it this week and I'll share it for more info. But it's a really fascinating connection. It's really beautiful and soft and feminine. And I feel like the more you learn about those connections between the heart and the womb and the womb and the kidneys, it just, I don't know, fills those gaps of different phases that we go through in womanhood from getting your first period all the way to menopause. They're important. Yeah.
And what can we do to support our kidneys?
That's a great one too. So our kidneys love dark food. So think about like antioxidant, dark, rich, juicy foods like blackberries and blueberries. They also love salty things, so naturally salty. Think about things that come from the ocean, so seafood and seaweed. Having those in your diet regularly are fantastic. From a Western perspective, we know that from seaweed, we're getting those omegas, right? Which are, something that your midwife or your OB is always going to recommend that you take during pregnancy too. So we can see how Chinese medicine has been around for thousands of years, and it's a medicine of observing, and how Western medicine is now catching up and just proving the points and um, more of those details for us that maybe weren't able to recognize 2000 years ago.
Yeah, interesting how it's all connecting now. We're having the studies to confirm what we've known
Mm-hmm.
for so long and the
Yeah,
information that's been passed down.
yeah, yeah, exactly.
And in terms of pregnancy, what are some common concerns that you support pregnant women with?
So thinking back to my professor saying anything that you wouldn't go to the ER for, the TCM and acupuncture can support you with. So really a number of conditions from things like morning sickness in the first trimester. There's certain acupuncture points that are indicated for nausea and vomiting. And you might have seen it. Have you ever seen those little C bands that you wear on a boat? Yeah, so those little C bands, they have like that little button, and you're supposed to put it on your wrist about a couple thumb widths above. And that's a acupuncture point called PC6 or pericardium number 6. It's the sixth point along that channel. So we use that point to help with morning sickness or nausea. Aches and pains too. Acupuncture for really optimizing blood flow and cupping and gua sha to get that blood flow moving into like the legs and the lower back and the glutes when we're getting bigger in that third trimester and our muscles are really overloaded and we're getting tired and sore. Anxiety, prenatal anxiety, acupuncture and herbal medicine is fantastic for. So anxiety, overwhelm, we're looking at the spleen, but we really want to keep that liver blood flow moving too. And, more advanced conditions like a breech baby too. So if a baby's head is up instead of down, there's an acupuncture point on the toe on the outside of the pinky toe, bladder 67. And we use this point in combination with an herb that's called mugwort or IE. So we put the needle in the toe, or you can just burn the herb over that point and it stimulates it. And it's used to turn breech babies. And it's worked for thousands of years. In my practice, I think that's still one that I'm always like, wow, this is kind of crazy. And mom will have her hands on her belly and she'll say, yeah, I can feel them moving. And if I'm palpating, we'll palpate before, check baby's position before their head up. I work in a midwife clinic. They'll confirm, baby's head up. They'll have the treatment. And then it's usually after a couple of treatments and 48 hours kind of thing is what I see most commonly. Baby will turn. We'll have another follow-up appointment a couple days later and baby will be head down. And I'm always like, okay, this is a little bit witchy. I don't know what's going on, but I love it so much. Yeah.
Wow, I have never heard that. I think I've said that a number of
Okay.
times here already, but wow. Yeah, it's almost magical, isn't it? I
It
think
is.
that there's a part of us as women that we're innately drawn to magic and witchery and like herbs
Mm-hmm.
and all those
Mm-hmm.
things. So, yeah, this is just so fascinating to learn about.
Yeah, I'm glad. Yeah.
And in terms of morning sickness, what are some other things that you suggest? Are there certain herbs or
Mm-hmm.
other parts of the body to support for that?
Yeah, yeah, that's a great question. So if I seen, say, 1 week I seen 20 patients that all had morning sickness and they were all the same symptoms, same time of day, so on and so forth. We're going to go in and we're going to do a TCM diagnosis for each patient. So the root cause of that morning sickness, it could be different in every single patient, which means that the herbal formula would be different as well, even though the symptoms that they're presenting with are exactly the same. So I think that's where herbalism is a beautiful thing because it's so unique, it's so personable. Um, and we're taking into account not just the symptoms that are showing up, but you as a person. A common one that our listeners have probably heard of is ginger. It's so lovely. So I feel like if you're pregnant, just have a good source of ginger for that first trimester. It's most likely that you're going to feel some sort of nausea. Hopefully you don't vomit and that you don't need anything further, but booking in for acupuncture, getting that acupuncture point PC6, having that ginger, and then for a specific herbal formula, we would have to do that intake and dive deeper for you.
But there are other options and that
Yeah,
people can
lots.
have.
Yeah, lots of different options. And Chinese medicine works a lot with formulas too. So it's common that a formula will have like 4 herbs, but we can use, I think, like one of the traditional formulas that has like 24 herbs or something like that. So we really can we have this opportunity to create these really customized formulas for you. And I think that's one thing that's different from Western herbalism, uses a lot of single herbs too. So just take your ginger, just take your tincture of Vitex, or so on and so forth. But Chinese medicine, we do a lot of formulas which really make it unique for the individual. Yeah.
It makes sense because everybody would have slightly different situations and root causes and symptoms.
Yeah, exactly. Yeah. And it makes, I think, people feel special to know that this is their tincture or their tea or their granule or their capsules that is just for them. Nobody else is going to be taking this formula.
Yeah, there's something there about being taken care of, nourished by
Mm-hmm.
your practitioner and being held in
Mm-hmm.
that way.
Yeah, yeah, exactly.
And what about in postpartum? What are some aspects of TCM that are really helpful for mothers in, say, that first 3 months, that fourth trimester?
Yeah, I love that question too. Yeah, postpartum and TCM is a really sacred time. It's called Zoyuchi. I'm probably pronouncing that wrong, but it's this really beautiful window of time that we're meant to just sit and rest and just be. And connecting with your body and your baby and acknowledging just this incredible and miraculous process of pregnancy and the journey of birth and just what that is and how transformative that is, and giving your body that opportunity to really rest and recover in the slowest possible way. So, in Chinese medicine, part of that is the first 40 days, you're not supposed to get out of your bed. You lay in your bed, and everyone else tends to the mother, keeping mom really warm, keeping your womb warm. And you don't lift a finger. Your food is brought to you. You are naked, doing skin to skin with your baby, and you are just completely taken care of. So that's something that I did postpartum with my two babies after. My husband took time off so that he could just be that like sole caregiver of the house. I didn't stay in my bed for the first 40 days, but I stayed in my bed for the first 2 weeks. Then I moved downstairs. I went to the living room, sat in my cozy rocking chair, and just stayed in there. And I would just get up to go to the bathroom. That's all I would do. And then after the month, then I went for my first walk outside, which was probably like a 2-minute walk only, just to get that fresh air. And you slowly start adding in more and more time outside, doing more around the house and whatnot. And I feel really privileged that I had that opportunity in today's world to practice that slow healing postpartum. Not everyone gets that. And here, where I live in Alberta, a lot of my patients and my friends, their husbands, they work away. They work out of town for, 2 or 3 weeks at a time. So a lot of people just don't have that opportunity with the cost of living and things like that. So, what can we do to support that? I think a postpartum doula is one of the best things that you could ever do for yourself. Just having that support emotionally and physically for you to just step back and really be is such a beautiful thing. Um, and asking for help and saying yes to everyone who offers. I think that we have a hard time accepting help in today's world too. And I think with social media too, we compare ourselves to other moms, but what we're seeing isn't real. It's like, of course, we're going to share all of these beautiful, happy moments with our children, or the vacation, or the new house, or the new dog, or whatever. But behind the scenes, we all go through these struggles and we all have these hard days, and we're always working to um, emotionally regulate ourselves and this and that. And I think when another mom friend, you can just be real with them and say, yes, I do need help today, or they offer, just say yes every time. If you're a first mom, just start yourself off on this journey by saying yes to all of that help, and it will really serve you well down the road.
Yeah, it really changes everything if we get that support and that rest during those first 40 days or however long it
Mm-hmm.
is that we can ideally get.
Yeah, absolutely.
And how do you feel now? Because you said you're 4 months out, is that right?
Yeah, yeah, my second, he's 4.5 months now. I'm feeling really good. Doing like some weight training at home, nothing crazy heavy by any means, but just like with my little dumbbells, just adding in some weight. Weight training is so great. Um, like my energy is really good. He's sleeping really well for this age. I've started running again, focusing on nutrition and spending time with family and friends that really, you know, make my energy feel so good too and help me feel lifted up when it is challenging, because it always will be. I think we go through these different phases when our children are different ages, and there's such beauty and incredible feelings of joy and feeling proud and whatnot of your child. But there's also different challenges that come with each season too. I feel like right now we're in a good window because our little guy, he's just starting to get more mobile, like grabbing his toes and starting to roll over and that sort of thing. But I think once he gets moving, then we're going to be really busy, and that'll be a new challenge for us to, yeah, travel through that.
Yeah, often with our first child, we're so excited for them to start moving. And then after
Yeah.
that, you want it to slow down because you realize it gets so much harder.
Yeah.
What do you recommend for a mother who's listening who didn't get the postpartum experience that you got and that you planned for? Because a lot of the time
Hmm.
we go into pregnancy and postpartum, we don't even know that we're supposed to slow down in this way because those ancient traditions are really lost in our society. And our
Hmm.
society is so excited about bouncing back and going back to that
Yeah.
identity and that body and everything that you were before being a mom.
Yeah.
So, what do you recommend that mothers can do if they're past that newborn phase,
Yeah.
but grieving over not having that support and that slowness? Are there things that
Hmm.
they can do now to
Hmm.
support themselves?
Yeah, I think always, yeah, there's always things that we can do. So I think the first thing that I would remind them of is that healing takes place in the form of months and years postpartum, not days and weeks. So TCM, we view postpartum as 2 to 4 years of after having your baby, not 6 weeks like Western medicine. Of course, there's that initial healing phase that's very tender and very raw and very, like just very there after you have a baby. But give yourself time and know that time is going to pass anyway. Time is going to keep on going. So, what can we do to support ourselves with that? Book in for the acupuncture treatment. I'm going to say that again and again and again. And ask your doctor of acupuncture what herbs you can bring into your home that are easy and they don't feel like a task or something you have to complete, but they add to your life. So you pick up that mug and you know this is going to make me feel so much better and bring me so much nourishment. Getting outside every day, even for a little bit, I think as a first time mom, you're gonna learn like, holy moly, like this really makes such a beautiful impact on my mental health. If you have other children, you can see that impact on them too. Just how much more regulated and connected and calm and grounded they are after they've had that time outside, and how good you feel as well. So, yeah, I think booking in for that acupuncture, drinking your herbs, spending time in nature would be three really great things to do for yourself, and reminding yourself that it takes time. It takes time, and that's okay.
Beautiful. And how can people work with you? You mentioned the couple clinics and that you have some courses. Like, what are the different offers
Yeah.
that you have available.
Yeah, so you can work with me one-on-one in my practice, or you're coming in person, we're working together, and I'm administering that acupuncture and that herbal support and cupping and so on for you. You can work with me virtually, so you can live anywhere in the world. You can book a virtual appointment with me, and we'll sit down and we'll talk about what it is that you're feeling and how we can support that with nutrition, herbal medicine, and lifestyle advice from a TCM perspective. You can sign up for one of my seasonal workshops. Like right now, I have my spring cleanse it. I have my last round of that happening. That will be annually from now on. So next spring, you could join us for that. I have a course that's called the menstrual course. It's quite extensive, and I'm going to open it up twice a year. So it will be, I started it off as a 6 week course, and it just was so much information. I feel like I created like a university course. So I'm going to make it 6 months and really slow it down so I can have all that one-on-one support with my students too. But if you follow my Instagram page, Dr.MamaBear, you're going to see that there's always something that you can do and that accessibility is a priority for me. So the menstrual course, it's a bit pricier because it's just so extensive, but maybe that's not for you at this time. So maybe you want to buy an $8 e-guide and send me some DMs and I can chat with you about some specific things about that too. And then there's everything in between. Lots of ways that we can connect.
And are there any resources that you recommend for people who want to learn more about traditional Chinese medicine? Are there any interesting books or podcasts to delve further?
Yeah, I love that. I am a reader, so I'm always reading, but I guess the books that I'm reading are um like textbook and like medical. So I'll have to look on that and then let you know. But I think in my Instagram page, I try to break down those complex things into a more digestible and simple way for the everyday mom that feels not too much and doable and easy and like you want to do that. And yeah, if you're pregnant right now, I would say to grab the book, The Fourth Trimester, or oh no, it's The First 40 Days. Yeah. And who is the author? I can double check that for you. But the book is called The First 40 Days, and she has one for fertility and she has one for pregnancy too. And they are beautiful. They have all the TCM rituals like acupressure, things like that. They have specific teas. They talk a lot about even the placenta. We didn't talk too much about that today, but um, placenta encapsulation, why you might want to consider that. But of course, it's your choice at the end of the day. But just different things like that gives you a bit more knowledge and understanding from that TCM perspective and what has worked for women all of these years. And um, I think also what a privilege it is to be able to add that into our own lives. So grabbing those books would be good, and then following along on Instagram.
Yeah, your Instagram is beautiful and has some really great information, and it is very accessible. And I do love the first 40 days. I didn't realize she had the two
Yeah.
other books. I'll have to check those out because that book is it's very clear and useful and has great
Yeah.
recipes and everything.
Yeah, yeah, it does. It's beautiful and it's just so aesthetic. You want to flip through those pages and look at all of those gorgeous photos too.
Yeah, absolutely. To change things a little bit here, this is a question I ask quite a few moms who come on the podcast.
Hmm.
What are you doing to support your children to have a healthy
Ah,
relationship with food and enjoy real food and not become picky eaters?
yeah, I love that. I love food. I'm such a foodie. I love cooking. And my daughter, who's 3, she cooks every meal with me. She's in the kitchen. She, very slowly is learning how to use a knife. So she will, I think when she was 2, we started using the butter knife to like cut bananas. And now she's using a real knife and like cutting carrots in the kitchen with me and like cutting onions with my supervision and, me being right there. But we talk about also what each food does for our body. So she's in the process of making it, touching it, smelling it, and then we're sitting together and we're eating this meal slowly. So back to that scramble this morning. My daughter, her name's Flora, and she said, Mommy, what is the yam good for? And I said, in Chinese medicine, the yam is really good for our spleen, so it helps our bodies to make blood. And, it's a complex carb, so it's giving us that slow release of energy that's going to help us feel good all the way until lunchtime. And then she asked, what is the egg good for, Mommy? It's high in choline, it's high in healthy fats, and protein, this and that. So I think just talking about the ingredients that you're using so they understand, what they're good for. You don't have to go that deep into it. But our children are always absorbing and they're just so intelligent and soaking up all of this information. And I think that 0 to 7 is really important for creating those foundational um, perspectives on food too. And another thing I do with her is I always encourage her to listen to her body. So if she doesn't like something, that's okay. You tried it. If you're full, that's okay. Listen to your body. This we can leave it out for you if you want. We can warm it up again later when you are hungry, but listen to your body. It will always tell you what it needs.
Yeah, those are great strategies. And your daughter is going to be a much healthier eater and have a healthier relationship with food because of them.
Thank you. Yeah, I think that, yeah, my childhood was it was just so, you're eating too much or you're not eating enough. And it was just so polarizing that that's an important thing for me that I want to make sure that I do my best with showing her that food is medicine and such a beautiful thing and you can enjoy it. Yeah.
Yeah. Was there anything that you wanted to mention here or anything that you wish I had asked that I didn't that you'd like to cover?
I don't think so. I feel like we talked about, yeah, such a good variety of things. And yeah, I just really appreciate you inviting me on here and getting to share more about acupuncture and TCM with your listeners because this is such a, personal medicine for me and a passion and my lifestyle too. It's so in our home and infused in the way we live. And I want everyone to have these things that have supported myself and my family. So I'm just super grateful to be here sharing more about what it is.
Well, thank you so much for coming on and for sharing that knowledge with us on socials, with your clients, and spreading that word and helping mothers and families to be healthier and have a lifestyle that's more in sync with how we're meant to because of it. So I really appreciate
Yeah,
that.
amazing. Yeah, thank you.